You're watching CTOM TV. Knowledge is power.
Fatima wants to know, are cancer misdiagnoses common? And should I get a second opinion from another oncologist or a service like yours?
Yes.
Let's start with the misdiagnosis.
Yes, misdiagnoses if you're going by basic pathology, I would say yes, that does occur quite a bit.
Mm-hmm. We've actually, in the last couple of weeks, sorry to interrupt, but it's top of mind. In the last couple of weeks alone, we've had a couple of patients with clerical errors. So the pathology was done accurately, but the translation of the pathology report to the oncologist was mixed up, and people were mistreated just as a result of that. Yeah. So you definitely want to have somebody double checking the data before your treatment begins, ideally, and then while your treatment is taking place.
Yeah, and thoroughly checking the medical records, because a simple error, a simple typo can be the difference between life or death.
Yeah.
Loss of treatment or a missed opportunity.
Yeah, again, we've had a couple of those just in the last week alone.
And this is common when you go between different hospitals, but also within, when you go between different departments of the same hospital. Mm-hmm. But as far as getting a second opinion, when I was in university in my undergrad years, I had this wonderful immunologist teacher, and he said, he stopped our class and he said, many of you will get cancer. He says, if you do get cancer, don't trust your doctor. And he actually said, doctors are stupid. He said, don't get one opinion, don't get two opinions. He says, get 7.
Oh,
so
wow.
That was his opinion.
Okay. Well, that's an immunology prof. So
yes, he was definitely a character.
In my experience, doctors are not stupid.
No, they're not.
They just can't know everything.
Yes, and he was a doctor too.
Okay, so I guess he had the right to say that.
Yes.
Right. But really, what the research shows is that oncologists are really overworked. Their core client loads are huge. And they really have such limited time that they're able to spend on your case, and that's why having a couple of people or having a research service, like Alex, have a snoop at your records is good.
They're just not trained in modern oncology. I mean, oncology has gone from pathology and chemotherapy to targeted therapies, and the requirement of understanding genomics. And that's a huge field, because we only discovered, we only transcribed the first human genome in 2005, 2006. Yeah. So this is all of these new drugs are incredibly new. And this just an abundance of information that is impossible to keep up with.
Yeah.
This is one of our goals, is to create a whole new field, a whole new discipline, of oncology. Well, I think it's really important that services like ours are the mainstream, and that our approach to how we deal with cancer is taught, so we can have so we can be using our services to help doctors all across the world improve their treatments.
And just to flesh that out a little bit, I mean, the service that you provide is ensuring that people get the most thorough diagnosis, and then doing a deep dive into what the most current research says, and then talking with your oncologist and advocating for patients to get access to things that aren't currently standard care, but have FDA approval and are well supported and documented.
Yes.
So really helping patients to get access to treatments that wouldn't be mainstream for 10 years or more, depending on the country.
Or maybe never.
That you are. Yes, that's right. Or maybe never. So, all right. Thank you, Fatima.
Thank you for watching CTOM TV. Subscribe below and stay informed.